So this is actually my last presentation of fellowship. I will be graduating next week. So thank you all for having me. So I'm going to be talking about two of the projects I've been working on during fellowship that focus on the impact of caregiver primary language on outcomes in children with congenital heart disease. So there's a growing body of research related to the impact of social determinants of health on outcomes in children with congenital heart disease. And the current literature shows that a variety of things impact outcomes, including neighborhood income, childhood opportunity index, insurance type, distance from a surgical center, parental education, race, and ethnicity. And these factors impact multiple outcomes, including hospital length of stay, complications, gaps in care, mortality, and neurodevelopmental follow-up. A gap, though, in the current literature is the impact of primary preferred language on congenital heart disease outcome. And the research regarding language is really important because more than 1 in 5 people in the United States speak a language other than English at home. And I always mention when I talk about my project that when I started this 3 years ago, it was 1 in 5. And so already in a couple of years, the proportion of individuals that speak a language other than English has become higher. It's now more than 1 in 5. And it's going to keep increasing. And within that population, about 38% of individuals report limited English proficiency. And there's already a very wide array of research showing the negative impact of language barriers on other areas of healthcare, including adults, preventative medicine, cancer screenings, a lot of different things. And so the current work that I've done first is evaluating the association between caregiver language and outcomes following high-risk congenital heart disease surgery, including postoperative length of stay and unplanned hospital readmissions. And then the other project is looking at the relationship between primary and secondary languages and neurodevelopmental follow-up for children who underwent congenital heart disease surgery in the first year of their life. And so first, to touch on the project looking at surgical outcomes, I completed a retrospective cohort analysis of infants at Nemours Children's Hospital here in Delaware from 2000 to 2025. And specifically, it was infants that underwent an index procedure categorized as a stat score of 3, 4, or 5 in the first year of life. And the stat score is a scoring system that we use to categorize surgery based on the complexity and the risk of mortality. And so 5 is the most complex and the highest risk. So we just looked at 3, 4, and 5 to focus on the higher risk surgeries. And the outcomes were postoperative length of stay and then unplanned 30-day hospital readmissions. And so looking at postoperative length of stay, there was no statistically significant difference between the English group and the non-English group. So the English group had a mean length of stay of 22 and non-English had a mean of 25. So there was a little bit of a difference, but it wasn't statistically significant. And then we conducted multivariable analyses. So this is the analysis for length of stay again. So we also looked at ethnicity, race, insurance type, area deprivation index, which we broke up into quintiles based on prior research, distance from the hospital, and then again, language. And here, language, ethnicity, race, and distance from the hospital did not impact length of stay. Area deprivation index and public insurance did have a longer length of stay. So for ADI, it was only quintile 2 compared to 1, with 1 having the least deprivation. So quintile 2 had almost a 39% increase in the length of stay. But interestingly, quintile 3, 4, and 5 didn't have a significant difference, even though those are the groups with higher deprivation. And then those that had public insurance had an almost 25% increase in their length of stay, and that corresponds with prior research. For unplanned 30-day hospital readmissions, those children that had a caregiver with a non-English primary language had a 55% greater odds of readmission, but this was not significant. And then those that self-identify as Black race had a 20% greater odds of readmission, but again, this was not significant, and none of the other factors showed any impact. And so then for my other project, looking at neurodevelopment follow-up, So this was also a retrospective study, and this was more specifically children that underwent cardiac surgery that required cardiac pulmonary bypass in the first year of life. So not necessarily those higher risk surgeries, but just anything that requires bypass, because we know that having to be placed on a cardiac pulmonary bypass machine does impact neurodevelopmental outcomes. And this was from 2019 until 2025, because we used the Neurodevelopmental Outcomes Collaborative, which started at Nemours in 2019. And so we looked at documented follow-up with neurodevelopment. And this study is more in the preliminary phases, but what we see so far is that, again, comparing those that had an English primary language versus non-English, and a higher percentage of children attended a neurodevelopment appointment if their caregiver spoke English. So 43% of the English group attended an appointment, while in the non-English group, it was only 30.9. And then we also kind of did like a spin on a survival curve, to see time to evaluation. And so here the teal color is the non-English group and the more like peach orangey color is the English group. And we see that the English group, the children were seen sooner for their neurodevelopment appointment. So about 5.8 months versus the non-English group was seen for the first time around 5.9 months, but this was not statistically significant, as you can see from the p-value here. And you can just also see that children tend to be seen around 5 months of age, and then it kind of drops off. So overall, for both of the studies, we see a trend toward language impacting the outcomes, but no statistically significant relationships. And we may be seeing these findings for multiple reasons. First, there could truly be no relationship between the primary language and the outcomes. It could be that here at Nemours in Delaware, our language services are helping to overcome the negative impacts of a non-English language. So we have in-person Spanish interpreters. We are able to get Haitian Creole and Arabic in-person interpreters, although that requires a bit more effort. We have iPad interpreters that can be found in pretty much any language. So it could be that all those services are helping, which of course would be great. But my main thought in moving forward is that our sample size is just too small. And so we're seeing a trend, but we would need a much larger sample size to really see the true effect. And so moving forward, ideally to conduct similar studies with a much larger population, and also to be able to control for language services, because that's the other really big limitation, is not knowing what services and how consistent those services were for these families. And so overall, these studies, I think, just bring up really important discussions that primary language exists within a greater social context that impacts how patients and families receive care. And the negative impact of language can be enhanced or diminished by many other factors, such as the caregiver's ethnicity, race, education level, insurance type, and socioeconomic status, not all of which we accounted for. And so future research is needed, which I hope to do, and I hope others do as well. That's it. If there's any questions, and I put my Gmail here since I will be graduating, so if anybody has any questions.